Hello, everyone, and welcome to the online press briefing on endocrine disrupting chemicals hosted by the Endocrine Society and IPEN. I am Jenny Glenn Gingery. I'm the Director of Communications and Media Relations for the Endocrine Society. We just wanted to go over a few ground rules before we get started with today's event. Everyone will be muted except for our speakers. We'll go ahead and take any questions from journalists following the speakers' presentations. So please be sure to type any questions you have into the Q&A chat box and include your name and outlet, please. This webinar is being recorded and will be available for viewing on the Society's YouTube channel in the coming days. So please look for it there if you need to follow up. We're very pleased to have with us the authors of our new report on endocrine disrupting chemicals. We have Andrea C. Gore of the University of Texas at Austin. Dr. Gore is a board member of the Endocrine Society as well as lead author of the report. Michelle Lamerle from the University of California at Davis, a co-author of the report, and Sarah Brochet, an IPEN science advisor and contributor to the report. I'd now like to invite Dr. Gore to speak.
Yes, thank you so much, Jenny. Let me share my slides. Give me just one moment. Okay, so good morning or good afternoon, everybody. As Jenny said, I'm Andrea Gore, here to speak about endocrine disrupting chemicals and the guide that we are just releasing today. I have nothing to disclose. So I'm going to give a little background on what led to this guide and also a little bit of background on endocrine disrupting chemicals, or EDCs, with this guide focusing on threats to human health. This guide, which was written in collaboration with the Endocrine Society and IPEN, sums up the state of our scientific knowledge about EDCs. This guide is resting upon years, if not decades, of research, hundreds, if not thousands, of peer-reviewed studies. There are many different kinds of EDCs. We're going to be focusing on plastics, pesticides, and what we call forever chemicals, or PFAS, as we'll describe later on. And the guide also does cover other chemicals that are found in household and children products and other persistent chemicals. EDCs really need to be a policy priority. And this has been recognized by the Endocrine Society since they began advocating for evidence-based regulation of EDCs since 2009. The Endocrine Society was responsible for the publication of two extremely important scientific statements, the first in 2009, the second in 2015, that laid out the science and the evidence not only for how EDCs act and concerns generally, but also specifically their relationships to human health. The Endocrine Society has also had multiple position statements focused on U.S. and global regulations, and has given input on many policy discussions, including those convened by the UN Environment Program, the EU, and the OECD. And of course, IPEN, our partner, has played very large roles in these things as well. And I'm sure Sarah Brochet, one of the speakers, will talk about that today. So it's my job to talk about more the scientific side of things, since I'm an endocrinologist. Along with Michelle Lamerle, I'd like to acknowledge Heather Patisal and Robert Sargis, who are our co-authors on this report. So without further ado, EDCs are chemicals that interfere with hormones and their actions. So just a little bit about hormones. Hormones are produced in glands that are distributed throughout the body, and they do a number of functions that are involved in growth, development, metabolism, stress, reproductions, and many other functions. They're necessary for having a good, healthy quality of life, and many hormones are necessary for life. So you can imagine that if these hormones are perturbed by EDCs, this can lead to different kinds of disorders and possibly even death. And some of the ones that have been best studied and covered in this guide include diabetes and obesity, cardiovascular problems, reproductive disorders and infertility, behavioral problems, because hormones also act upon the nervous system, and certain cancers, especially those cancers that are hormone dependent. So over the years, the science on EDCs has really grown along with our understanding of how important environmental factors, including EDCs, are in disease prevalence and also disease severity. And this really comes from a convergence of evidence that has grown over the years based on work in cell lines that might mimic endocrine cells, animal models where we can expose animals and then show direct causation of disease by exposure to EDCs, and also from growing evidence from human epidemiology. So together, these sort of three legs of research have led to very strong evidence linking exposures to EDCs to detrimental health outcomes, including in humans. And this has been acknowledged by numerous international scientific and medical organizations that have not only agreed with the science published by the Endocrine Society, but have also called for stronger regulations. There we go. Just spending a moment on what we consider some of our most vulnerable populations. As you can see here, a baby chewing on some plastic toys. And it's very well accepted that EDCs pose the biggest risk at certain key points during the life cycle, particularly developmental ages. So a mother when she's pregnant, where she is exposed, as well as the fetus, the developing infant, young children, people going through puberty. These are all times in our life cycle when hormones are undergoing the greatest change, where there's the greatest amount of development, and where exposures to environmental chemicals are most likely to have an adverse outcome. I will add that we are never immune to endocrine disrupting chemicals. Every life stage is important, but these are the ones that we are particularly attentive to. This understanding that early life development is so important in setting the stage for a lifetime of health and disease and determines the trajectory of whether or not we're going to develop an endocrine disease has led to this concept of what we call the timing makes the poison. And by that, we mean that it's not just how much of a chemical you're exposed to. In fact, with endocrine disrupting chemicals, even very low level exposures to EDCs during vulnerable developmental periods can have quite profound outcomes. We also know that EDCs can have effects across multiple generations, and that's probably through their actions on the developing cells that will become the sperm and the egg cells, and thus the next generation. Okay, so our EDC guide has several topics. I'm going to talk about the first one before I turn it over to my colleague, Dr. Lamerrill. I'm going to talk about plastics and plasticizers, many of which are known EDCs. And this is just a map from 2018 from IPEN, where they showed where plastics are being produced around the world. And let me make the point that although these may be where plastics are made, these plastics can be disposed of in other parts of the world. They can be broken down and released and get into soil and get into air. So really the entire world is now being exposed to all sorts of different plastics. And I'm going to talk about two kinds of plastics that are known endocrine disrupting chemicals. The first is bisphenols, and I'm sure everybody has heard of bisphenol A, BPA. I would like to mention there are many other bisphenols, and BPA has been substituted by some of these other bisphenols. We are exposed to bisphenol through many different routes. A major source of exposure is leaching through reusable food and beverage containers, can linings. medical and sports equipment, eyeglasses, thermal paper receipts, plastic pipes, adhesives, paints, and lacquers. And I also added a little note that when you see something in the supermarket that says BPA free, it does not mean bisphenol free if there's a replacement bisphenol, and it may not even be BPA free, as IPEN has shown. Many BPA free so-called products actually still contain BPA. And the second class of plastics we review in the guide are phthalates. They're a huge family, and we're exposed to them through PVC products, personal care products, fillers in medications and supplements, packaging for food and beverages, processing materials that are involved in making these materials, children's toys, and medical tubing, as shown here for intravenous tubing. So we know that plastics are EDCs. There's universal acceptance about that. And so I just wanted to mention some of the areas where there's the strongest evidence for their effects. In brain development, as I said, the brain is very sensitive to hormones, and there are associations between phthalates and anxiety, depression, and neurobehavioral disorders like attention deficit hyperactivity disorder, metabolic problems like diabetes and obesity, reproductive problems, including problems with fertility, ovarian or prostate problems, sexual function, hormone levels. Certain cancers, such as breast, prostate, ovarian, and endometrial cancers, are associated with exposures to bisphenols and phthalates. They interfere with thyroid hormone action, and also cardiovascular disease and hypertension, which are also regulated by the body's endocrine system. So just quickly, I wanted to throw this slide in because many people think that if we recycle plastics, everything will be okay. But as IPEN published recently, there's this paradox that even though we think we're doing the right thing, we're taking chemicals that arose from fossil fuels and petroleum products. We're using them, but then they may get just thrown away in dumps. They may get broken down, which may actually release more of those toxic chemicals into the environment. And for the sake of time, I won't go through all of these points. They're published by IPEN, but I like this comment that plastics poison recycling is recycling toxic chemicals. And we really need to start with materials that are toxic free to be safe. So I'm going to end there and stop sharing and turn this over to Dr. Michelle Amaro.
Thank you so much, Dr. Gore.
Thank you, Dr. Gore, as well. I'm just getting my slides ready. Just a moment. Okay. So I'm going to talk to you about pesticides as well as PFAS chemicals. So PFAS stands for per and polyfluorinated alkyl substances. These are currently commonly referred to as forever chemicals. They're found in a multitude of products, some of which you can see here. They make up water repellent type of objects we use in our daily lives. So pizza boxes where your greasy pizza isn't falling through, the cardboard can be lined with that. Anything where you're trying to separate materials. So Gore-Tex jackets, for example, no stain clothes and carpeting, nonstick pans, and so forth. Over 5,000 PFAS have been identified, and this number continues to grow. The two PFAS that are most commonly studied and most abundantly used to our knowledge are called PFOS and PFOA. They're being replaced actively by other PFAS, including one called Gen X. And a big concern about PFAS is that they're very common water contaminants. They're found throughout drinking water supplies in the US and can be abundant in our foodstuffs that are associated with water, such as shellfish. So IARC of the WHO, the International Agency for Research on Carcinogens, has classified PFOA recently as carcinogenic to humans, which is group 1. They suggest that PFAS may cause testicular and kidney cancers. There's also evidence abundantly that both PFOA and PFAS delay puberty in rodents, particularly related to the mammary gland or the rodent breast. And PFAS have also been associated with delayed puberty in girls. And the mechanism of this seems to be the ability of PFAS to bind the hormone receptors and also to disrupt levels of hormones. And these hormones have included our sex hormones like estrogen and testosterone, as well as the important thyroid hormone. With respect to pesticides that may be EDCs, our guide highlights several pesticides. We focused on DDT, glyphosate, which is also known as Roundup commercially, chlorpyrifos, and some others, including atrazine, which is a herbicide. So if we first highlight some of the effects of DDT, DDT is a highly persistent pesticide. Many countries have banned DDT use, including the US in the 1970s. However, exposure to DDT and its toxic and also persistent metabolite called DDE continue worldwide. They can accumulate in our foodstuffs as well. Further, DDT continues to be produced in India, and migration can bring people with high levels of DDT and DDE in their bodies across the globe. And this has been documented with Indian immigrants to the US in recent times. Excuse me. So DDT and DDE also are widely recognized as being endocrine disruptors. So numerous studies have demonstrated that DDT, and especially its more persistent metabolite DDE, are risk factors for both obesity and diabetes. There's also evidence in experimental systems that both can influence our sex hormones, such as the estrogen and androgen or testosterone systems, particularly mimicking estrogen or blocking testosterone signaling through their receptors. And so, as you heard from Dr. Gord previously, the health consequences of DDT and DDE exposures both appear to be most pronounced when those exposures occur to developing fetuses as well as to children. Moving on to glyphosate. So this is the most widely used herbicide in the world. And glyphosate was first synthesized in 1950, and it took a couple decades before we, as a large, broad community, not myself personally, identified its herbicidal properties. And then in 1974, Roundup became commercially available. In the past 20 years, glyphosate exposure among people has risen quite dramatically. For example, in samples collected in 2013 to 2014, over 80% of participants had detectable levels of glyphosate in their urine, and similar levels have been found in the European Union as well as people of Australia. So glyphosate has many of the key characteristics of endocrine disruptors. It can perturb the signaling from our pituitary, which is a part of our brain that tells our sex organs to produce sex hormones. And so we see alterations in production of various hormones. including in particular the production or synthesis of estrogen. And after the hormone is made, there also seems to be additional signaling issues. So not just the hormone signaling from the brain to the sex organs, but when those sex organs produce the hormones, they too, those hormones have to do their own signaling. And those responses have been impaired by glyphosate as well. There have been some studies of glyphosate in people. So exposure of pregnant women to glyphosate has been shown to have an increased risk of late spontaneous abortion, also known as late miscarriage. And glyphosate exposure among pregnant women can also increase the risk of shorter duration of pregnancy or increased preterm birth. And then I'd like to highlight chlorpyrifos, which is a pesticide used to get rid of different types of pests, such as cockroaches and termites. And chlorpyrifos is not as persistent as some of the other chemicals, but it can remain in the environment for up to 4 years. Chlorpyrifos and its metabolites are found in many human samples, including human urine, maternal and umbilical cord bloods, meconium, which is the first species of newborn infants. It's also been found in breast milk, in cervical fluid, in men's semen, and in infants' hair. So strong evidence of early life exposure. And chlorpyrifos was banned in the EU in 2020 due to their concern about DNA damage and developmental neurotoxicity in particular. It also has endocrine disrupting properties that I'd like to point out. So in particular, it's well known for its nervous system effects by inhibiting an enzyme called acetylcholinesterase, which is very important for putting brakes on the brain system so that we don't have a hyperactive brain, so to speak. But some of the more direct influences of chlorpyrifos on the hormone system include thyroid hormones. And so there's some evidence to suggest that chlorpyrifos can actually be a risk factor for thyroid diseases. There's also numerous evidences about developmental exposure to chlorpyrifos, which of course relate to the nervous system, but also the hormones that control the regulation of our lipids or fats and our glucose, and how those important substances are metabolized. And there's also some evidence that chlorpyrifos can influence estrogen as well. For example, human breast cancer cells having more aggressive behavior in laboratory studies. And with that, I will turn it over back to IPEN. Thank you for your attention.
Thank you, Dr. Lamerle. I'd now like to invite Dr. Brochet to present.
Thank you very much. And hello, everyone. I am joining this from Kenya, where the UN Environment Programme has its annual meeting. So my internet is not completely reliable. So I'm going to say that up front, that if I get into trouble, Jenny has promised to help me out with the PowerPoint presentation. And I am just going to start with, Jenny, can you confirm that you can both see the presentation and hear me?
We can.
Perfect. Thank you so much. And definitely, first of all, also thank you to the Endocrine Society, both for the really important work through decades on this issue, and also, of course, for our collaboration on this and other reports, which has been hugely helpful in the international policy space, but also for colleagues of mine around the world. So first, just a little bit about IPEN. We are a global network of civil society organizations. We have partners in about 125 countries. The main focus is on low and middle income countries and work there. And here on the screen, you can see some of my colleagues around the world. And the approach that we are taking is really a science-based approach to generating evidence and data of local problems, bringing that to an international policy space to promote and advocate for international policies. And then when these policies are put in place, also to help and support partners around the world to implement them or support their governments to implement them to make sure that global action is taken. And just to show you a little bit more about what that can look like, I just wanted to show you some photos from a couple of recent studies on PFAS that we did in clothing and in water. And also just to mention that one big problem in these countries is usually that there's such a lack of data. It's very hard for governments to take action if they don't have the evidence to show that there is a problem. So that is also something that we have as a priority to generate scientifically sound data. And a few recent reports that relates to EDC exposure is about PFAS in food packaging. We looked at BPA in baby bottles, some labeled BPA free, but did contain BPA, as mentioned. And also looking at different country situations. I put up a photo here of PFAS in Indonesia, in microwave popcorn, among other things. And as already presented, the suffering caused by EDC exposure is huge and significant. But if that wouldn't be enough, there is actually also a societal cost of EDC exposure. There's been studies done by Dr. Leonardo Chisande from New York University School of Medicine on the cost of EDC exposure. So that is the healthcare cost, but also the loss of income and sort of the loss of taxes and so on and so forth. And this is huge. So looking at some policymakers are more eager to look at this aspect of things. So that is one other angle of the problem. And of course, if it is a developing country or low middle income country, that is just one more impact that will make the country have even more problems to deal with their problems. Plastics is, of course, a huge topic at the moment and a huge problem. And what is projected moving forward is that the plastics production is just increasing exponentially. And as mentioned, plastics made out of fossil fuels, and then you add chemicals to that plastics. So as plastics production increase, you can also see there is a projected increase of chemical production. So basically the conclusion we can draw is that the more plastics that is produced, the more EDCs are produced and the more exposure we have. And we also see that when the world is moving away slowly, but still away from fossil fuel driven vehicles, the industry needs to shift their focus to something else. And that has become single-use plastics and plastics in general. And that has also just exploded over the last couple of years. So this is a very clear strategy. And I'll come back to some of the exciting policy things that are happening globally on this issue. PFAS pollution was also mentioned. This is from PFAS contamination of drinking water in the US. There are similar maps done for the EU, which shows similarly shocking results. And if the data was available, I'm pretty sure this would look the same everywhere. And adding to that is also not only exposure from drinking water, but also from food and from consumer products. And we have no idea of knowing what we are exposed to. And what is known, though, is that every study shows that wherever you test someone's blood or other biomarkers for PFAS exposure, everyone is exposed to PFAS. Pesticides is an enormously problematic issue in many countries, and especially highly hazardous pesticides. They are the most toxic ones. These are the ones that are typically banned in the EU, in the US, and other places, but then are still produced and exported to low and middle income countries. where they are used with really harmful effects, both on human health and the environment. And as mentioned, if you have a global problem, you need to have a global solution. And what we see globally is that we have real-life health effects already seen. There is no way for the public to know what EDCs they are exposed to. And even if we actually knew, it's impossible for you and me as ordinary consumers to be able to select a product without EDCs, select the plastics without EDCs. It has to come down to global and national regulations. Everyone has the same right to be protected wherever you live. So that is really the foundation for our work. And we have to utilize both existing global agreements, but also, of course, then develop new ones to cover the gaps. And this is a very exciting thing that is happening right now. There is a negotiation internationally to have a new international legally binding agreement, a convention on plastics. What the end outcome will look like, we don't know. IPEN and colleagues are very heavily engaged. I know the Endocrine Society is very engaged in this process as well. And based on these facts, that we will see also just an increase of plastics production and EDC exposure. We know that problem will become much worse without any international action. We see it as a chemicals and health treaty, because where you have plastics, you will have EDCs and other toxic chemicals. So what we see is that this treaty, this convention, this legally binding agreement, has to prohibit the use of toxic chemicals in plastics. Of course, we cannot continue the big increase of the production of plastics, because it's not only a consumer product, it's a waste problem. And this waste is exported. A lot of countries in Africa are getting huge amount of plastic waste exported, and they have no ability at all to deal with that. So that means that it's either dumped in big landfills, which is not manageable at all, or burned in the open, producing a lot of toxic chemicals, toxic fumes, and suffering. As also mentioned, recycling is not the answer, because you don't remove toxic chemicals when you recycle anything. You just spread them to the new products. PFAS, huge global problem that needs to be dealt with urgently as well. The solution as we see it is to ban the use of all PFAS. There is actually movement in the EU to what they call restrict all PFAS. So that means putting control on the uses of PFAS because of human health and environmental problems. What we also see that in this EU movement, there is an open consultation where all stakeholders can submit comments. And the people working on this in the EU has never seen anything like it. There's huge industry pushback with over 5,000 comments submitted, compared to maybe 30, 40 at the most for other issues. But there is also the Stockholm Convention as a global agreement that has started to deal with some PFAS, but needs to be utilized to be much more effective and ban bigger groups of PFAS. And the final thing I wanted to highlight is also there is a new global alliance endorsed and established to phase out highly hazardous pesticides. This is under another international agreement that is called the Global Framework on Chemicals. This global alliance was initiated last year, and they are right now starting to take the first steps to establish this. And this is really a way to trying to deal with the issue, which is not legally binding, but gathering stakeholders internationally, but also nationally, on dealing with the issues and seeing what different pathways could be taken to prevent exposure, to prevent highly hazardous pesticides, and eventually a global phase out of all of the hazardous pesticides. And that was everything from me. Thank you very much.
Thank you so much, Dr. Brochet. We'll now begin taking questions. So for starters, I have a question from Rose Rimler from the podcast Science Versus. We have evidence that these chemicals at the population level in blood, urine, and other tissues. Do we have evidence at the population level of people having unusual hormone levels?
I can feel that. So there is in the US an enormous database referred to as NHANES, or I'm going to probably mutilate this, but the National Health and Nutrition Examination Survey, which has been sampling groups of humans around the US for decades. And every year, I think they sample something like thousands of people where they'll take blood or tissue samples, and then they'll measure the presence, they'll look for specific chemicals, and they'll measure the presence of them in these people. They can, in the same samples, also measure hormone levels. And so that's how, in many cases, we've actually reached the conclusion that chemicals are associated with hormone levels that are not in the expected range, where they can show those kinds of relationships. So there's quite a lot of evidence out there.
Great. And Rose has a follow-up question. Dr. Brochet mentioned there's no way for the public to know the EDC content of products. What about databases like the Environmental Working Group's Skin Deep Cosmetics database? Can we trust those conclusions?
I think the initiatives that has been done, like this one, on trying to make the content public is really good and a very useful thing. At the same time, it's hard when, first of all, you have to know that you should look for these chemicals in the products, and you have to have the app when you go. I think it's an app. There are other ones that are just apps on your phone. So you have to remember to take it out, and you have to look for it, and then you have to look for it in everything you buy. So it's a great initiative, but it's also, from my perspective, not enough. It's a good tool and should really be commended, but it has to be also regulated. That's my view on things.
And if I may add one comment, I think we're kind of at the beginning of empowering people to be able to know what they're exposed to, what's in their body, what's in products on the supermarket shelf. Emily Hills, a postdoc in my lab, has developed an app that can be used to scan just products in a supermarket, look at the contents, and then link to a database that will show whether any of these compounds are EDCs. And I should add, it's particularly geared towards products targeted for Black people. So it also is for different populations who may be using different products or may be exposed to different chemicals. But I do think we're in very early days of knowing what we're exposed to. And hopefully we'll have more of these, more ability to measure in the future.
Great, thank you. I have a question from Mike Monastra from Helio Endocrine Today. Why do you believe government agencies are so dismissive of regulating EDCs in the US in particular? The EU appears to be making some progress, but there appears to have been little progress made in the US.
I don't know if Michelle wants to try to answer that. It looks like maybe you're trying to unmute yourself.
Yeah, thank you. I think that there are kind of different philosophical approaches from the US compared to the EU. And of course, I'm not an international expert on, or an expert on international relations so much, but my impression is that in the EU, they use something called the precautionary principle, which is to hesitate to have things in widespread use a little bit before they're used, and to be more willing to act on evidence that suggests chemicals can be unsafe. Whereas in the US, everything goes out into commerce without as much oversight. And once there becomes a growing body of evidence for toxic action and human exposure, that it is hard to move laws in the direction of public safety as rapidly. For example, we were close to having chlorpyrifos banned a few years ago, and then that got eliminated as an effort. And so I think that is at least part of what.
Great, thank you.
I would also say, I don't think that the US government is dismissive. I just think that there's a lot of pressure coming from lobbies. This country is, politicians are very strongly influenced by lobbies who may be in their districts. If there's a company that is producing chemicals and the law is going to change to make it more expensive to test and regulate the chemicals, there can be pressure put on politicians not to support those regulations. So I don't know if it's a matter of being dismissive. I think it's just a matter of how the system works or sometimes doesn't work, as is the case in the US.
Maybe I will suggest add to connect to that to an international level where we see the exact same thing, that it's a lot of industry lobbying happening. I mean, we keep repeating the same conversation about, is EDCs even a thing? Is that even proven? And so there are organizations working to prevent international regulations on this with a lot of money and a lot of influence.
Great, thank you. The next question we have is from Andrew Turley of Chemical Watch. To deal with endocrine disruptors, we have to be able to identify them. You highlight mostly very data-rich substances. Most substances are very data poor. Currently, validated test methods are not very good for identifying endocrine disruptors. How optimistic are you about the development of new test methods, and should we expect a lot more animal testing?
So again, I don't know, Michelle, if you want to start. I can talk about animal testing for just a second, which is that there's a push in the US to try to reduce and eventually eliminate animal testing. And I have tremendous respect for animals that are used in testing. I do experimental work on rats in my lab. And we try to minimize that as much as possible. But I am terrified that if we don't test chemicals on animals, then we're never going to be able to identify chemicals that are endocrine disruptors, because the endocrine system is very complicated. And while you can do so much with computer modeling of a chemical and see, does it resemble other chemicals that might bind to hormone receptors, there's good cell line work where you can test whether a chemical activates a hormone receptor like the estrogen receptor. But at the end of the day, you need to look at the endocrine system in the context of the body. And the only way you can do that ethically is in animal studies, because we're never going to intentionally expose humans. So I guess that only addresses a bit of the question, but I did want to make that point.
Yeah, I completely agree with Dr. Gore. I would add that, there's this concept called the key characteristics of endocrine disruptors, and looking at their properties. I think that there's only a few of the tests that are done by, for example, the US EPA that cover just a few of those characteristics. So the majority of those characteristics are not really addressed by any particular regulatory assay. So I think there is room to develop more non-animal tests to evaluate different properties of chemicals that are consistent with endocrine disruption. I think, you know, unfortunately, the sad truth is that we have finite resource in terms of the number of people working on it, the number of dollars available, and the amount of time. And we have more and more chemicals coming out, as you saw from the IPEN graphs of plastics use over time was just one example. And unfortunately, no matter how much testing you do, you'll never really know if you tested every single aspect of the hormone system, because there's many hormones, and hormones are so important that they're very tightly regulated, and the way that they operate through many different actions. And so whether or not you're using a computer model, a cell in a dish, a rodent, or even human epidemiology, there'll always be something missing from those studies. And to have to balance that in opposition of a growing chemical space due to increased production, I think the strategy that IPEN proposes of just eliminating the production of many of these would be a more efficient step forward.
Great, thank you. So our next question is from Steve Tolokin. Thank you for the briefing. Can you comment more on what sort of provisions the group wants in the plastics treaty? The plastics treaty talks thus far have had a lot of difficulty coming to a consensus on some key topics. Do you see consensus in the plastics treaty around regulating EDCs? And Steve works for Plastics News.
From IPEN side, one of our key issues is, of course, to regulate what chemicals are used in plastics, and also regulate the worst plastics polymers as well. So that's a key issue for us. When it comes to EDCs and chemicals, I think the first step is for governments to agree that chemicals needs to be regulated in the treaty in relation to use or the whole life cycle of plastics. So I think that's the first step, and then going into groups of chemicals that should be regulated. Some of the groups that could be included have been presented here, like PFAS, like pesticides, or subgroups of that. On the topic of consensus, that's tricky. Of course, we would hope that everyone see the sense in regulating chemicals in plastics, because this is something that affects everyone in all countries and would benefit all countries. So we, of course, hope and work for that there is a compromise that can be made that everyone can agree to start addressing these chemicals in plastics. Yeah, I think that's it for now.
Great, thank you. See, our next question is from Mike Monastra from Endocrine Today. With plastics being so abundant, has there been any idea suggested for how to replace plastics with another type of less harmful type of material?
I can start on this one as well, but please others jump in as well. There are a number of different suggestions around replacing materials, but I think also the key is to look at what uses of plastics we need. The first step would be to reduce the use of plastics, and then look at the uses that are important and look at the alternatives and what they are. So whatever replacement it is, it comes with problems. Bio-based materials comes with problems because of then you divert your production, your agricultural production maybe towards producing container materials or whatever it can be. So the key is really to start drastically reducing the use of plastics, and at the same time look at what is the best alternative materials.
Great. Dr. Gore, do you have anything to add there?
I guess just one comment, which is that in sort of a more general way, thinking about regulation, I know, and I'm not an expert in regulation, but I've heard people talk about making more effort to try to eliminate families of chemicals, including families of plastics. So rather than marching through all of the bisphenols one at a time and, starting with BPA and BPS and BPN and so on, just agreeing that as a category, these chemicals are endocrine disruptors. You could do the same thing for the phthalates. You can do the same thing for the perfluorinated chemicals, and trying to get more creative in finding replacements that are not in the same class.
Great, thank you. The next question is from freelance journalist Emma Bryce. Do you know if the US FDA is still reconsidering its safe daily ingestion limits for BPA? Is that process still ongoing?
I have not heard anything about that. I know when they published what they call the Clarity study a few years ago now, and arrived at what they consider to be and I'm going to put in quotes, safe level of BPA. My impression was they felt the matter was closed, but maybe somebody else has heard differently. I do want to add, since I've brought the subject up of Clarity, that what they did say as the safe level, and I don't want to say what it is because I don't want to get it wrong. I think I know what it is. But what they said was the safe level was not found to be safe in some of the testing protocols that were conducted by some of the academic labs around the country. So I have a lot of concerns about that safety level from the FDA for BPA. But if somebody knows more about whether that has been revisited, please speak up.
Great. And Emma, our science policy director, is telling me that the US has not, but the European Commission has proposed a ban with provisions for other chemicals that are derived from bisphenol A. So we can get you more information on that after the fact if you want to email media@endocrine.org. Our next question is from Alden Wicker. Would a helpful first step from governments be to mandate disclosure of ingredients and products beyond food, cosmetics, cleaning products, such as in food packaging, clothing, baby toys, etc.? As of right now, a lot of energy research money is being expended on even proving these EDCs are in these products to begin with. I'm thinking of research proving PFAS is in cosmetics and children's clothing.
I can speak to that initially. I mean, I think, making sure that the public is well informed is a great idea. At least I think to some degree superficially. However, I have a few concerns. One is if all the labels are there, but people don't know anything about what the label means, they're not really going to make a decision about those substances. And I would be concerned a bit about people becoming somewhat desensitized. If everything had a ton of labels, how would that disproportionately affect people living with poverty who had multiple jobs and not enough time to read all the labels? And if there's not enough information about those substances, we already have a lot of ingredients on the backs of consumer products that a lot of people aren't familiar with and don't know how to critically evaluate, and so therefore probably not making decisions on their basis. And so I think that is one of the reasons why IPEN moves in the direction that they move in for elimination, but I'll let them speak directly about that.
That is absolutely right. And also looking at the global trade flows that we have today, that it complicates things further. And when it gets to the waste stage or the recycling stage, it complicates it even further. So our main ask and talking point is really there has to be regulations. It cannot be down to the individuals. Some of us have a chemistry background and can at least understand some of what's on the labels and in the list of ingredients, but most people don't. So it's really about the different countries' responsibility to protect people.
Great, thank you so much.
It's not just the labels, it's also the packaging. I mean, I can't get a head of lettuce in the supermarket without it being in a gigantic plastic clamshell.
Great. Well, I think that is all of the questions we had in the queue. So I just wanted to say thank you again to our speakers and all the journalists who joined us today. If you have any follow-up questions, please feel free to reach out to our counterparts at IPEN, or you can reach our team at the Endocrine Society at media@endocrine.org. This recording will be available on the Society's YouTube channel in the coming days. And again, if you need to set up an interview with any of the experts, please reach out to IPEN or the Endocrine Society. Thank you so much for joining us.